Syphilis is a sexually transmitted disease, a common bacterial infection that spread through sex. Syphilis is easily cured with antibiotic medicine, but it can cause permanent damage if you don't get treated. The main ways people get syphilis are from having vaginal and anal sex. It's less common to get it from having oral sex, but it can happen. You can get syphilis when your mouth, genitals, or other part of your body comes in contact with a syphilis sore. Syphilis is very easy to give to other people in the beginning when there are sores, but lots of people don't even know they have syphilis because they didn't notice the sores. Using condoms every time you have sex is one of the best ways to help prevent syphilis, even if you and your partner seem totally healthy. Syphilis isn't spread through casual contact, so you can't get it from sharing food or drinks, hugging, holding hands, coughing, sneezing, sharing towels, or sitting on the toilet. A mother can also pass syphilis to a baby during pregnancy and childbirth, which can be dangerous. Syphilis can be easily cured with medication if you treat it early, but without treatment, it leads to really serious, permanent problems like brain damage, paralysis, and blindness. That's why STD testing is so important. The sooner you know you have syphilis, the faster you can get rid of it. The bacterium that causes syphilis is Treponema pallidum. It is a slender, fragile, anaerobic spirochete. The two major routes of transmission of Treponema pallidum are sexual and transplacental. Sexual exposure to a person who has an active syphilitic canker carries a high probability of acquiring syphilis. The organisms enter a susceptible host by penetration of intact mucous membranes or the minute abrasions in the skin surface that occur during sexual intercourse. The organisms multiply locally at the site of entry, and some spread to nearby lymph nodes and then reach the bloodstream and may lodge into any organ. Within 2 to 10 weeks after infection, a papule develops at the site of infection and breaks down to form an ulcer with a clean, hard base, also called a primary lesion. The canker is painless and most frequently occur on the external genitalia, but it may occur on the cervix, perianal area, in the mouth, or anal canal. Cankers usually occur singly, but in an immunocompromised individual, such as those with HIV, multiple or persistent cankers may develop. The stages of syphilis are primary, secondary, and tertiary, which will be talked about later on. These bacterium can cross the placental barrier from the bloodstream of an infected mother and cause disease in the fetus, where it may develop an asymptomatic infection or symptomatic infection with damage to the bone and teeth, deafness, neurosyphilis, or neonatal death.
History of syphilis. The exact origin of syphilis is unknown. There are two hypotheses about the origin of this disease. The first is that sailors who accompanied Christopher Columbus throughout his expedition brought the disease back to Europe. Second was, it was already present in Europe and was not identified as a separate disease from leprosy in the Old World. The first recorded outbreak happened in Naples, Italy during the 1945s. The disease then spread across Europe.
The Tuskegee study is one of the most well-known unethical studies in U.S. history. In 1932, the Public Health Service, working with the Tuskegee Institute, began a study to record the natural history of syphilis in hopes of justifying treatment programs for blacks. The study initially involved 600 black men, 399 infected with syphilis, 201 who did not have the disease. The study was conducted without benefits of patients' informed consent. Researchers told the men they were being treated for bad blood, a local term used to describe several ailments including syphilis, anemia, and fatigue. In truth, they did not receive proper treatment needed to cure their illness. In exchange for taking part of the study, the men received free medical exams, free meals, and burial insurance. Although originally projected to last 6 months, the study actually went on for 40 years. In July 1972, an Associated Press story about the Tuskegee study caused a public outcry that led the Assistant Secretary for Health and Scientific Affairs to appoint an advisory panel to review the study. The study had 9 members of the fields of medicine, law, religion, labor, education, health administration, and public affairs. The panel found that the men had agreed freely to be examined and treated. However, there was no evidence that researchers had informed them of being in the study or its real purpose. In fact, the men had been misled and had not been given all the facts required to provide informed consent. The men were never given adequate treatment for their disease, even when penicillin became the drug of choice for syphilis in 1947. Researchers did not offer it to their subjects. The advisory panel found nothing to show that subjects were ever given the choice of quitting the study, even when the new, highly effective treatment became widely used. The advisory panel concluded that Tuskegee was ethically unjustified. The knowledge gained was sparse and compared with the risk the study posed for the subjects. In October 1972, the panel advised stopping the study at once. A month later, the Assistant Secretary for Health and Scientific Affairs announced the end of the Tuskegee study.
Treatment and prevalence. Treatment and prevalence. Currently, there are no home remedies or over-the-counter drugs that will cure syphilis. Syphilis is easier to cure in its early stages. A single IM injection of long-acting benzathine penicillin G will cure a person who has primary, secondary, or early latent syphilis, while 3 doses of long-acting benzathine penicillin G at weekly intervals is recommended for individuals with latent syphilis or latent syphilis of unknown duration. Treatment will kill the syphilis bacterium and prevent further damage, but it will not repair damage that has already been done.
Syphilis is divided into 4 stages. Syphilis is divided into 4 stages, with each stage having a different sign and symptom associated with it. The 4 stages are primary, secondary, latent, and tertiary. During the primary stage of syphilis, you may notice a single or multiple sores at the location where the syphilis entered your body, such as the mouth, the penis, the vagina, or the anus. These sores are usually firm, round, and painless. Because they're painless, they can easily go unnoticed and usually last 3 to 6 weeks and will go away regardless of whether you receive treatment or not. Even if the sores go away, you still need to receive treatment to prevent the syphilis infection from moving to the secondary stage. During the second stage of syphilis, you may have skin rashes or mucous membrane lesions. These mucous membrane lesions are sores in your mouth, vagina, or anus. This stage usually starts with a rash on one or more areas of your body and can happen when the primary sore is healing or even after it is already healed. The rash looks like a rough red or reddish-brown spots on your hands and or the bottom of your feet. Sometimes the rash doesn't itch and is so faint that it goes unnoticed. Other symptoms may include fever, swollen lymph glands, sore throat, patchy hair loss, headaches, and fatigue. These symptoms will go away with or without treatment, so it's important to still receive treatment anyway to prevent the infection from progressing to the latent or the tertiary stage. This third stage of syphilis is the latent stage. During this period of time, you will not have any visible signs or symptoms of syphilis. If you still do not receive treatment, you can continue to have syphilis in your body for years without any signs or symptoms. The fourth and final stage is the tertiary stage. Untreated syphilis does not always progress to this stage, but when it does, it can affect many organs in your body, including the heart, blood vessels, brain, and or the nervous system. Tertiary syphilis usually occurs anywhere between 10 and 30 years after the infection first began, and is very serious as it can lead to organ failure or even death.
Syphilis infection rates in California, and especially in San Joaquin County, are extremely high for an STD that is very easily treatable with antibiotics. Even more troubling are the cases of congenital syphilis that are also very easily treatable. The fact that cases of congenital syphilis are so high also means that women in our area are not receiving prenatal care as they should, since this is a common screen that is completed at that time. In the fetus, syphilis can cause low birth weight, premature delivery, cataracts, deafness, seizures, or death. As can be Syphilis. As can be seen here, this is the infection rate for San Joaquin County over the time period of about 25 years. Even in 2015 versus 2016, you can see that there was a 50% increase in syphilis infection rates and more than a 50% increase in congenital syphilis rates. Even comparing 2016 to 2017, it was noted that there was a 44% increase, making San Joaquin County the second highest county for infection rate in the state. In San Joaquin County, there are many resources for STD testing and treatment. Firstly, on this slide, you'll see the information for San Joaquin County Public Health. This information listed below is for the main office in Stockton, California on Hazelton Street. They offer no-cost and low-cost screening and treatments. Secondly, for screening and treatments, we have Planned Parenthood. So they do not just offer pregnancy testing and birth control, condoms, those types of things. They do also provide a service for STD screening and treatment, also at no cost and low cost. They are located all across the country. And this is the information for the North Stockton office of Planned Parenthood. They have many offices, not only in Stockton itself, but in San Joaquin County. They offer the services listed below, along with some of their facilities even offer prenatal visits, care, and referral to other clinicians that can provide those services.